appreciated. I'm following up from a program that we did last year on Medicare, and I learned quite a lot from our meeting last year that I need to speak more slowly as my accent, and also I trying to go through things a little bit more slowly and give some tips along the way. As over the last year, Carol and I have received a lot of calls about Medicare, and I'm really trying to build a couple of many of those calls and questions into this relatively short presentation. As Carol will say, we're not professional advisors. We're just trying to give you a helping hand here, and also to help you figure out how to get some answers. So very briefly, the Medicare program was enacted in 1965, so it's getting on now. It's quite old now. And there's over 65 million people covered. That's 1 in 5 of our population is covered by Medicare, which is a lot of people. Included in that group are seniors over age 65, people on long-term disability, and 2 special categories of people with end-stage renal disease and people with ALS, Lou Gehrig's disease. The cost of the total program is about $750 billion in 2020. It's a huge amount of money, over 15% of the budget, and it's growing pretty fast. And as consequently, it is fairly complicated to understand, and we're trying to simplify some of that. Now, why are we having this meeting now? The main reason is, next slide, please, Lynn. Going to the 3rd slide. The main reason we're having this meeting right now is it's open enrollment season. So open enrollment season is now until December 7th. So you have all the things that we're going to talk about today. You have time to really consider any options you want and make some changes. You do not have to take any action if you're happy with your current choices. But if you might want to consider choosing a new plan, it's at least worth looking at the options. So really, we're trying to encourage you to at least look at some of your options. About 50% of Medicare beneficiaries never look at their choices, and there are more and more choices every year. So we do encourage you to at least think about looking at what your options for changing, upgrading, etc. Any changes you make in your health plan choices will be effective on January 1, 2021. And there's a wonderful website, which you can link from this slide, which is www.medicare.gov for more information. We're going to talk about that more later, Carol in particular. Thank you, Lynn. So basically, original Medicare is Part A, which is hospital care, and Part B, which is physician and other non-hospital services. And then between those 2 parts of the program, there's often a supplemental plan you can buy called Medigap, which I know many of you have. The second option, of course, is Medicare Advantage. Now, Medicare Advantage is a much newer option. And basically what it is, it's an alternative to Medicare Part A and B. And you can, we're going to talk about it quite a bit. I'm getting questions about it all the time. But they basically bundle together Part A and Part B, and usually drugs. And you basically select that plan in lieu of Part A and Part B. And then the third part is outpatient drugs, Part D drugs, which were added relatively recently under George Bush Jr., the younger. Under his administration, we finally got outpatient drugs added to Medicare Part D, which has obviously been very valuable. So Lynn, if we could go to the next slide, thank you. So original Medicare, which is now the language that Medicare uses, original Medicare, Part A covers your hospital inpatient care, skilled nursing facility care after hospitalization, and it's relatively limited, home health care, and also hospice care. And I just want to focus on hospice for a minute because quite a few people do not know very much about hospice care, and it is a benefit that is very helpful to people in their last few months of life. So you choose hospice care when you're not in a position to have care that would make you get better, but it's really care that would make you feel better, and pain management provides a lot more care for family members and supportive care. So the hospice care is something that I think more and more people are using, and it's very well accepted by the people who choose it. In Medicare Part A, the deductible for 2021 is over $1,400. After 60 days in hospital, which is a very, very rare situation, there's very little coverage and no catastrophic coverage at all, unless you have some Medigap coverage. There's extra help available for low-income individuals to help finance all of this. Then if you could go to Part B. So the next part of the original Medicare is basically Part B, and this is the area that covers a lot of what you get, routinely: your physician services, outpatient services, ambulatory surgery center care, outpatient cancer care, some home health care, some drugs, durable medical equipment like wheelchairs and things like that, physical and occupational therapy, and mental health services. Next slide, please, Lynn. And the original Medicare Part B, covers a lot of things, and the premium that everyone pays is $148.50 a month now for Medicare Part B. Low-income people get extra help, and higher income people can have their premiums up to $500. It's an income-related premium, and some people say, "Oh my gosh, when I look at my premium, it's not $148." And that's it's because your income is higher, and not many people pay the higher income amount, but some people do. The Part B deductible for 2021 is $203. And as you know, probably many of you know, cost sharing for most of Medicare Part B is about 20%. So let's just go through a few tips that I've learned over the last year or so that people ask us all the time. It's very important to understand that you have availability under Medicare Part B, original Medicare, to get a free annual preventive and wellness check. And that's something, Medicare program really encourages people to have. You also get your flu shot, and this is a very timely reminder of that because it's time to get your flu shot, and they're readily available in your doctor's office or CVS, and of course, no other pharmacies, etc. We also wanted to add in that Medicare now is currently covering most of the COVID-19 tests, including antibody tests. And we just learned that Medicare will be covering the COVID-19 vaccines. And I learned today that the new infusion therapies that are available to help people get better quickly, the new infusion therapies, I understand, are going to be covered as well. It's important when you have original Medicare that you look for a Medicare participating physician. Most physicians in our country are participating with the Medicare program, which basically means they accept the Medicare payment as payment in full, except for the cost sharing that's allowed. If you choose a Medicare participating physician, you really avoid extra bills, and it can really add up. So fortunately, most physicians do participate, but just keep that in mind as you're looking at your options for physicians. And lastly, this is one of my #1 calls I get from people, including something happened to me this year, is coding errors. So you go to the doctor and have something done, and you get a note back from Medicare or Blue Cross or whoever it is saying, it's not covered. And honestly, what happens a lot of times is there might even be just a coding error. So what you need to do is to go back to your doctor, ask whether it's covered, call Blue Cross, call Medicare. But if you think that there is something you've had should be covered, there's an appeals process available. It's very user-friendly, and what the case is referred to an external group. The group evaluates and says, yes, it should be covered, or no, it shouldn't be covered. So just because you get denial, I really recommend that you look at that closely before you go ahead and pay your bill, because oftentimes there can be mistakes in coding and things like that. Thank you, Lynn. So Medigap, and this is an area that I'm not as familiar with, but many people choose to buy Medicare supplemental insurance to supplement Medicare Part A and Medicare Part B. It's obviously privately, you buy it privately from private health insurance companies. It fills in some of the deductibles and co-insurances in the original Medicare. And there are lots of choices, and it's a highly regulated market. And if you can just go to the next slide, Lynn, the regulations both at the federal and state level, and you have choices of plan design A through N, and it's very clear as to what the different coverages are. There's not a lot of flexibility within the packages, but they have quite a few packages from which you can choose. And it really is a matter of your risk, how much risk you want to take, financial risk. So we can just go to the next slide, Lynn, but that information is readily available on medicare.gov. So the next thing I want to talk about is Medicare Advantage, Medicare Part C. Now, this is a relatively new part of Medicare, and it really grew out of the really early 70s and 80s when HMOs were established, health maintenance organizations were established, and lots of employers started using them, and there really wasn't any thing similar in the regular Medicare program. So over the last 20 plus years, the Medicare Advantage program has grown up. And basically what it is you choose to get your care through Medicare Advantage plans instead of original Medicare. And the Medicare Advantage plans can be HMOs, health maintenance organizations, or preferred provider organizations. So different ways of getting your health care. And then under the Medicare law, the Medicare Advantage plans are required to cover Medicare Part A and B, and often Part D, which we haven't got to yet, but as I often say, D is for drugs. And so oftentimes the drugs are included in the Medicare Advantage plans. There are limits on maximum out-of-pocket costs, and I recently looked up under a policy website, and it said the out-of-pocket costs were in Medicare Advantage plans maximum of $4,821 on average. So that it basically tries to limit your total out-of-pocket costs. There's sometimes extra benefits in these Medicare Advantage plans: vision, dental, hearing, sometimes transportation. They vary by plan. And the premiums, the monthly premiums, can be as low as $0. And sometimes, actually not in this area, but in some parts of the country, the Medicare Advantage plan even pays part of that Part B premium I mentioned, the $148. They even pay part of that. No Medigap is permitted because the Medicare Advantage plan is essentially an integrated A, B, and Medigap and D. So there are things you need to think about before selecting a Medicare Advantage plan. You often need to use in-network providers, and you often require to have referrals to specialists unless it's an emergency. One of the really great things about Medicare Advantage plans is they are rated by quality. They're called star ratings, and the 5-star is the best. The plans can be a more budget-friendly option, and it's really worth checking carefully on the Medicare Advantage plans. Next slide, please, Lynn. You know, how do you find a Medicare Advantage plan? So you can try this again. You can click the link, the Medicare Advantage link, which you see right in front of you, the blue, or you can call Medicare. Just a few tips here based on questions I've received in Carol to look at the cost and the benefit. There's lots of extra benefits sometimes, and sometimes no premiums, but there's other kinds of cost sharing. You have to look at your geographic availability. If you have a second home somewhere else or travel a lot, which isn't happening right now, but travel a lot, you're sometimes limited to using providers in other parts of the country, except in the case of emergency. So another tip to think about when you're looking at a Medicare Advantage plan is look at your health providers in the network that they're providing and make sure you're happy with the choices before you join. If you've got a provider you really just do not want to leave behind and they're not in the network, then maybe Medicare Advantage is not for you. Once again, look for a star rating. The 5-star rating is best. And in our geographic area, I looked up today, and Carol sent me the info, and the only 5-star plans are Kaiser Foundation health plans. So they are the 5-star plans. There are 9 choices of health plan, Medicare Advantage plans in our area, which is less than in a lot of other parts of the country. For some reason, Medicare Advantage is not as advanced here in Washington, but it's growing fairly quickly. Thank you, Lynn. Next slide, please. Medicare Part D is the new benefit. Well, it's new, it's 2006. It's an optional benefit. It's offered by private plans, and it basically provides outpatient drugs. We are really lucky to have this benefit because up until 2006, outpatient drugs weren't provided, and it was a very, very difficult situation. The standard package, there are standard packages of Part D drugs available, required by federal law, and you can get them through these private plans or through Medicare Advantage plans. The deductibles vary by plans. The cost sharing varies by plans. Drugs are put in different tiers, with drugs in higher tiers that might have much higher cost sharing. So some, like generic drugs, might have very little or no cost sharing. Some very expensive drugs might have 50% cost sharing. So it's really worthwhile looking at the plans. And the premiums vary by plan. There is extra help for low and moderate income people. And there is additional premiums for higher income people, that is an additional $77 a month maximum. Next slide, please, Lynn. So just a few tips on the Part B drug benefit. It's really, really, really important to read your notice of when you get in your mail, the annual notice of change in your Medicare drug benefits. There may be some drugs that you take that have been changed in your health plan. They may have been put into a different category. They may cost more, and you want to really look to see are there other plans that might have your drugs that might be more cost effective. And there are tools on Medicare.gov that are very easy to manage, believe it or not, really easy to look, and you just plug your drugs in and it shows you what the costs are in the different plans. If you're turning 65, don't delay on initial enrollment. If you want to get your Medicare Part D drugs, and I really can't think of many good reasons not to opt for this plan, there's a stiff penalty if you delay. So don't delay if you really want to keep the Medicare Part D drug benefit. When you're can you just back up, Lynn, just 1 minute? Thank you, I'm so sorry.
Okay, 1 second. I'm going to have to.
Sorry. So when you're shopping, as I mentioned before, when you're shopping for your Medicare Part D drugs, do check to see that your drugs that you use are on the plan, on the same plan that you have right now, and you have until December 7th to change your plan. Another thing that's come up periodically as I've talked to people about drugs, sometimes they say I can't get a drug, or when I went to CVS or Giant, they said it was going to be, $340 for this drug, and it's just too much. And there's several things you can do about that. First, you can talk to the pharmacist, and I have done this myself and said, look, is there any option here? Is there something less expensive that might be just as good? You can go back to your doctor and say it's too expensive, what are my options? You can also talk to the health plan to see, if it's the only one you can take, is there an exception policy? Lastly, there are drug discount cards available that you could use. One is GoodRx, and the only reason I mention that is because it's one I've used, and you can use a drug discount card in lieu of insurance, and sometimes it's cheaper to buy it with a drug discount card, which usually don't cost any money at all. They just negotiate prices with drug companies. And the last thing, which applies to both Medicare Advantage and this Part D drug benefit, is consider having your premium deducted from your Social Security check. The worst situation I had to deal with, financial situation I had to deal with from a senior this year was this situation where they were paying their Medicare Advantage premium through their bank. And all of a sudden, for whatever reason, the bank stopped paying. I think it was a 97-year-old member. I think things just got confused. And we had a heck of a job to get his coverage reinstated 3 months later. So, you know, things happen with banks sometimes, and you can choose to have this deducted from your Social Security check, and it's worth considering. Thank you, Lynn. I'm going to hurry up now because I'm taking up Carol's time. Carol really insists that I say this, and it's really important, that there's a lot of there are services not covered by original Medicare. Dental services, dentures, eye exams, lots of eyeglasses, hearing aids, long-term care services, cosmetic services, and there's very limited coverage for overseas travel. So just keep that in mind as you're thinking about your Medicare and supplemental choices and things like that. Next slide, please, Lynn. And we just added some resources here that a number of these resources you can read from. Medicare.gov is an amazingly accessible website. I highly recommend looking at it. Even if you're not really good at computers, it really holds your hand as you're going through the website. And there is at the bottom of the page here, there's a Kaiser Family Foundation. If you're interested in really understanding more about the program and how it's funded and who gets what and what it looks like, Kaiser Family Foundation has wonderful resources for you. Let me turn it over to Carol now. Thank you, Carol.
Oh, thank you very much, Diana. That was great. I hope folks learned a lot, and there's some things that I can fast forward through that you have touched on and explained perfectly. So thank you. Always great to share a stage with you. It's been more years than I want to count at this point. Exactly. For my portion of the program, and let me add my thanks to that of Lynn and Diana, I'm going to basically cover 3 areas. And as Diana said, neither of us is a trained counselor on health insurance matters. We don't work for 1-800-Medicare, but we do have a long history here. So we're happy to share tonight the information that we have, and also answer questions. And then for Georgetown Village members, as Diana mentioned, we do schedule conference calls or Zoom calls, that sort of thing, to help you through your individual problems. So the 3 portions of the presentation I'm going to talk about here are effectively using your Medicare and You Handbook. That's going to be the focus of most of what I talk about. I'm going to talk about the different parts of the program, and Diana really laid out very well for you how to get information online about this. And I do, you know, I'm coming into this new century here and teaching at George Washington University. The university's pulling me into Zoom teaching, so I'm having become more facile online than I've ever been before. But you don't have to be facile online in order to do these things. And I will talk to you about who you call and where you find the information to call people, and how you can effectively use a paper or online copy of the Medicare and You Handbook for 2021. And then the third thing I'm going to do for you this evening are 2 illustrative examples of the kind of money that you need to set aside on a yearly basis, because, you know, Diana went through these deductibles and premiums and contributions and co-insurance. That stuff can add up pretty quickly. And how much it's going to cost you depends upon your plan choices, and it also depends upon your health status. So it's what I'm going to do for you is, I would say, illustrative, but I think it gives you some sense of the expense here. So Lynn is going to show you, not for the purposes of reading these pages, just so you can somewhat see what these different pages look like. Now, I got a copy of my Medicare and You Handbook 2021 in the mail about 2 months ago. You can also find it online if you just Google Medicare and You 2021, and it comes right up. And it's a daunting book. I will say that. It is 128 pages, but it's laid out pretty well for you to try to use as effectively as possible to get the most that you can out of the program. And unless you've told the program that you don't want a copy, you should get a copy in the mail. But again, it's available online, very easy through any Google or any other search engine. I've never found that it doesn't just come right up for you. Next page, Lynn. Right inside the front cover, the program lays out for you what's new. Diana mentioned the COVID coverage. That's really important for this year, obviously, for vaccinations and for the newest treatments for COVID. I would also mention that telehealth has greatly advanced, and that's talked about here as a result of the public health emergency in which we find ourselves. And physicians and consumers, patients are accessing telehealth more than ever before for obvious reasons. It was a door that was open during the public health emergency declaration at HHS, but people really expect that it's going to continue for some period of time and be more broadly available. So though there's the two things that, as I look at what's new here, probably most important to point out to you for what's going on now and then also for next year. Moving on to the next page, Lynn, the table of contents. And here I'm going to just very briefly talk you through the sections of the book that I think are most important. The first section, and it's not necessarily the easiest thing to do, navigate getting into the program. It's the first section of the Medicare and You Handbook. Most people, as Diana talked about, come to the program. If you're already on Social Security, you can get your premiums deducted from your Social Security check, and that's really the easiest way for you to do it. But if you're not already on Social Security getting income from the program, you have to affirmatively sign up. And there's a 7-month period during which you're eligible to sign up. But I signed up immediately 3 months before I was eligible. That's the earliest that you can do it. I did it online. It was really very easy. And I think there's no particular reason for you not to just jump on it and get the coverage as soon as you're eligible. The other way, the other large grouping way that people come to the program is working aged. And that basically means that you're still working, but your employer will generally ask you to sign up for the hospital insurance coverage that Diana talked about, Part A, because you're entitled to that from 40 covered quarters, 10 years of having worked and paid Social Security taxes. So your employer will generally ask you to sign up for that. And also important to know, though, you don't have to sign up for the physician and Part B other services and necessarily Part D prescription drugs and get a penalty and worry about a penalty, because if you have creditable, what's called creditable coverage with your employer, then you can get a certificate from your employer later when you're no longer working and sign up for the program without any kind of penalties. So those are the three main ways that people come into the program. The second section really walks you through, and I'm still on the same page, Lynn. Second section really walks you through a good focus on what Medicare Parts A and B cover. And Diana mentioned what's not covered by the Medicare program. On page 51 of this book, it lays out in detail. She mentioned most of the important ones. I would also mention what you come to think of as a physical, an annual physical per se, is not paid for by the Medicare program. There's a Welcome to Medicare assessment of you the year that you join the program. And there's also a Medicare wellness visit each year, but it's not the typical physical that you think of. So that's just something that's important to know. Section 3 mainly draws a distinction between Medicare fee-for-service, or original Medicare as the program now calls it, and Medicare Advantage plans. And Diana talked about that quite a bit. Section 4 is, again, it goes into more depth on Medicare Advantage. Across the country, about 40% of Medicare people, beneficiaries, end up in a Medicare Advantage. Now, she said there can be a lot of differences by region, but that's the national number for you to know. Medicare supplement plans fill in the gaps. Diana talked to you about those gaps in coverage, and the page that we showed you here is page 72 of the Medicare and You Handbook, and that lays out the 10 types of Medicare supplement plans that you can get and can purchase. I chose for myself Plan G. If anybody wants to ask me why, I'm certainly happy to go into that. I chose AARP. You have to be a member. I'm not promoting AARP here. I have found that plan useful for myself, but you can also get plans from local health insurance agents that are regulated by the state, and kind of the coverage outline is regulated through the federal government. And then Section 6 is the prescription drug coverage, and Diana talked about that quite a bit. So we'll move past that. So those are the main sections of the book that I would bring your attention to. And Lynn, could you give us the next page? Okay, getting started, and I'm following along myself here. Excuse me. Mainly what is on this page are the deadlines that we've already talked about. And this is just to get you started. The program suggests you start maybe even a couple weeks before the open enrollment, assessing what it is that you want to know and what your options are in the area. Moving on to the next page, that shows you Part A, the main portions of the Part A program. It tries to do it in a simple way. Part B and Part D, and directs you to where in the book you can find more information about all of those. Moving along to the next page, your Medicare options. This really, over these next few pages, attempts to make as simple as possible what your Medicare Advantage choice means to you versus staying in original Medicare. If you stay in original Medicare, you will probably want to purchase a supplemental coverage plan because, as Diana pointed out, there are a lot of gaps in coverage here. I am personally very grateful to be in the Medicare program, but it's an expensive program and it can cost money to participate in it, and there are some coverage gaps. So you'll probably want to do that. And as she talked about Medicare Part D, the drug plans, prescription drugs are not covered in original Medicare. You're going to have to go out and get additional coverage for that. So, and on the other side of that page, you see Medicare Advantage. It covers A, B, it covers, most of them cover drugs, extra benefits, and you don't need a Medicare supplement plan if you're in a Medicare Advantage because you already have the coverage you need that's provided by the supplement. It's not exactly the same coverage, but you don't need a Medicare supplement plan and Medicare Advantage. That would be duplicative coverage for you. So please don't let anyone sell you a plan if you don't need it. Moving on to the next page, which is page 8, as I'm looking at it here. The one thing I would highlight here is for you is that the coinsurance, as Diana pointed out, is about 20% for original Medicare. And that's different. You could probably get better coverage in Medicare supplement than that. And this just lays out for you what the differences are between these two types of plans, and why, if you're willing to potentially trade a larger network of providers in your area for a more defined network, which is generally what the plans do, not all of them, but generally what they do, then you might get a better deal out of this situation. Moving on to the next page, what I would highlight here is in the middle there, that little airplane that says travel. For the most part, Medicare coverage does not travel with you. Some examples I've read of Medicare providing coverage out of the country, or let's say you're in upstate New York and it's closer and less expensive for you to go to a Canadian hospital, for example. So the Medicare program may pay for that, likewise in the southern part of the country. But for the most part, Medicare doesn't travel with you. If you look at Medicare supplement plans, 6 out of 10 of them provide some travel coverage. And I know it's anomalous to bring this up right now because, you know, most of us are not traveling very much. But if you're going to be leaving the country, you know, I would very much suggest you take a look at the Medicare supplement options. Okay, moving on to the next page, which is getting the most out of Medicare. Here, what I'm going to talk about is the types of phone numbers and information sources for you. And again, you've already been given in the slides a lot of the .gov and other places that you can look for information online. I myself, as I said, am coming into this new century as much as possible and trying to learn how to operate more online, but it's also possible to operate with the paper copy of the book and to get the information that it is that you really need. So eligibility questions go to the Social Security Administration. Well, why the Social Security Administration? Well, that's because when the Medicare program was created, there was a Bureau of Health Insurance and the Social Security Administration, which was at that point still part of the Department of Health and Human Services. It's now an independent agency. But that, it just explains to you why when the program was split out from the Social Security Administration into what was the Healthcare Financing Administration and now what we lovingly call the Centers for Medicare and Medicaid Services, that particular function remained with Social Security. So just know that's why you have to go to Social Security Administration for eligibility determinations. For general questions about the Medicare program, I would refer you to 1-800-Medicare. I would say getting through to Social Security on the phone is time consuming. I've never gotten through inside of an hour. It's usually more like an hour and 10, 15 minutes. So make yourself comfortable, get a book, you know, do your email, have something else to read or do. And then at the point at which somebody comes on to help you, they'll be very helpful, but it just takes a while. Getting through to 1-800-Medicare is a lot easier. And you can ask them general questions about the program and Medicare Part C and D. Now, if you don't want to go online to look at C and D plans, if you look at the Medicare and You Handbook that you get in this area, and I'll just, if you can see me in addition to the screen slides, this is my own copy of Medicare and You 2021. And this is for Maryland and DC. So in the very back of the book, the Part D plans that are offered in the area and the Medicare Advantage plans that are offered in the area are both laid out on very high level with coverage information, just very general coverage information. And you can take a look at that. You can see deductibles and premiums and co-pays or co-insurance, that sort of thing. And then you can get phone numbers and you can call the Part C and D plans. So Social Security eligibility, 1-800-Medicare, Part C and D plans available through your Medicare and You Handbook. And then I definitely recommend using, getting a Medicare supplement policy. Now, for those who are poor or near poor, you may get some help from the Medicaid program. For those who are retired from employment, whose employers provide retiree health coverage for them, you probably don't need a Medicare supplement plan. But if you don't have either of those, I would strongly recommend, because of the coverage gaps, that you look into something from a local health insurance agent or through AARP, which is, again, the choice I made for myself. And I would say, so you've got kind of 5 areas where you're going to need phone numbers. So this is not a simple program, but it's well worth examining your options. And then finally, pages 10 through 14, which Lynn will not throw up for you here, are an index of the rest of the book, which is interesting because the index isn't at the back, the index is at the front. And using that index, you can find for yourself pretty simply the information you need, and it directs you to the pages in the book. The last thing I'm going to do for you here tonight is just give you 2 illustrative examples of expenses in the program and thinking about how to plan for this. I just did them for myself. One's a national example if you stay in original Medicare. The other is drawn from the Medicare and You 2021 actual examples of plans that are available to you in the DC area. And that's where I live. So I looked at those plans. So let's say you stay in original Medicare and you have Medicare Part A based on your work experience, no additional cost to you. You sign up for physician and other services in Part B, which we recommend. That's $150 roughly, it's $148.50, but just for the purpose of doing some simple math, let's just call it $150. The Part B deductible is around $200. You sign up for a Medicare Part D plan when you're eligible. The base national premium amount for the plan this past year, I think, was about $30 a month. So let's just factor that in and say $30. And the Part D deductible for 2021 is $445. So just for, for purposes of doing a calculation and giving you something illustrative, let's just assume that. You sign up for Medicare supplement plan, and the average national premium for that over the past year has been about $160. And let's just, I'll add it up for you in just a minute. And Diana mentioned how expensive the program can be if you are at certain income levels. There are 5 different income levels that the program sets up for income-related premiums. You can Google them online and they come up pretty quickly. Just for the purpose of this example, I'm going to build into the example the lowest level of income-related premiums, which are $60 more a month for Part B and $12 more a month for Part D. And it's worth noting that it's paid on an individual basis. So if you're joint filers, you're paying twice. You pay for, your spouse is paying and you're paying. So it's not a joint expense. You don't sign up per se together. So if you add all these numbers up, it's about $5,600 a year in an illustrative example where you're a fairly healthy beneficiary and may not be using a lot of services. Let's look at an illustrative example, part 2. You sign up for Medicare Advantage Plan, and again, I looked in the 2021 book here, and you have Medicare Part A based on your work experience, no additional expense to you. Medicare Advantage provides coverage for A, B, and D. It's possible in the bidding process that the plans manage to arrange themselves so they buy down your premiums and buy down your deductibles. It's all part of the bidding process and what they're able to arrange. And they also, as we've talked about, can provide additional services for you. So just taking as examples 2 from the book, I found in the DC area, there was one plan. The cheapest plan is a 0 premium plan. You pay nothing per se to join the plan. You just sign up. The most expensive is $142. It's interesting that they're fairly comparable in copays for access to primary care services and low-cost generics. They're very nominal, if any, fees. So just looking at that and adding in the lowest cost additional premium payment that's related to your income, that would be roughly $1,000 if you buy the 0 premium plan. Again, I'm assuming you're fairly healthy. The more services you need, the more expensive it can be for you. Up to $3,000 for the more expensive plan where you're paying the premium of $142 and the income-related premium at the lowest level. And the lowest level, I think it's $82,000 for an individual. I have the numbers written down here somewhere, and 170, it's 87 for an individual, 174 jointly. But that keeps going up each year too. I think the Medicare beneficiaries calculate that. And Diana mentioned the average out-of-pocket limit for Medicare Advantage plans, around $4,800. So that tells you you're not going to, all the Part C plans will have an out-of-pocket limit. You can buy an out-of-pocket limit with a couple of the Medicare supplement plans, but if you stay in original Medicare, you may not have a de facto out-of-pocket limit. So that's something else to be thinking about. So those are just a couple illustrative examples that I'm trying to lay out for you just to let you know how important it is for you to understand your benefits and examine them year by year. The program is fine with your staying with the benefits that you originally chosen. And you don't have to shop if you don't want to, but what could happen to you here from one year to the next in a Medicare Part C plan is your provider could leave that plan and you stick with the plan. And now all of a sudden your provider's out of network. That could be very much more expensive for you. Another problem could be for your prescription drug coverage. Maybe your pharmacy is no longer participating in that particular plan. And as Diana talked about, your drugs may be moved to a different level. So at a minimum, even if you're happy with your plan, I would strongly urge you to look at making sure your provider remains in the plan from year to year, and what the premiums and deductibles are going to be for you, and then whether or not your providers are in those plans, because it's really going to be important to your provider or your pharmacy. And I hope you found this useful. Diana and I'd be happy to answer any questions that you have here. As we've mentioned, for those who are in the village, where Georgetown Village, we do one-on-one consultations to try in our own way to help you through this information. And hope everybody's staying safe and enjoying their evening, and perhaps sipping on some wine while you're learning a little bit more about the Medicare program. So Lynn, I think we're done and we're open to Q&A.
I have a question.
Yes, sir.
And I just came on a little while ago, so forgive me if you've answered it already. But does the Irma apply equally to Advantage plans as to Part B, A, and B coverage in the same amounts?
Yes, it's my understanding that they do. You don't get away from the Irmas just because you're in a Medicare Advantage plan.
Okay, thank you.
Any other questions? Just to give you a little more background there, the Part B, the physician part, mainly physician part of the program, it's a 75% subsidy. So if you're paying about roughly $150 a month, there's a 75% subsidy for the expenses that you're provided in that part of the program. And the program looked at this, and Part B expenses are going up very quickly, and said, look, we want, and I'm paying them too at one level. So, I don't like to see them either, but, policymakers were looking at this and thinking people who have upper incomes, higher incomes can help pay more. And then that just ended up getting translated over into the Part D program too. So that's the rationale, even though it can become very expensive, especially if you're a couple and you're both paying.
Carol, I have a question.
Yes, ma'am.
It's Carol Robinson.
Sounds like.
You said, you mentioned things not covered being eye exams, but it says in the book, it just says for prescription glasses. Does that mean that eye exams for eye health is covered?
If it's my understanding, if just a simple refraction to go in and get glasses, that doesn't apply. But if you have a history or family history of macular degeneration or some real health needs, or you're in an accident, and you need eye health care, it's going to provide that, but your routine refraction will not be provided.
Well, refraction only applies to getting glasses.
Yeah, Carol, can I add something to that?
Sure, please.
I was, much to my shock, when I went to get my eyes checked when I first became eligible last year, my review of my eyes was covered. I couldn't believe it. I thought for the longest time, no, there's no coverage, but my eye exam was covered, and so was my husband's. So I think we need to check on what the specifics are around that. But if you're going to get your eyes checked, I would definitely ask if Medicare covers it.
Yeah, the last time I was at the eye doctor, she said to me if she can document or have a concern about an eye health problem, then she can charge Medicare for it. But that's certainly something that we can look into for you.
And is D required? When I talked to Medicare, it sounded like it was a requirement.
No, Part D is optional. The Medicare drug benefit is optional. It's on you whether you decide to take it or not.
Really? That's certainly not what they told me.
I mean, there are many reasons. I can find very few reasons to think that you wouldn't take it, because it really fills in such a big gap that previously existed. But it's, Carol, correct me if I'm wrong, but it's my understanding it's completely optional.
Absolutely. It's optional. If you look in the Medicare and You Handbook, it lays out the penalty that you'll pay if you don't sign up right away. And once you decide you need to get into the benefit, then you're going to pay that additional premium as long as you're alive and staying in the program. So I think it's worth signing up for a benefit right away. Now you can look in the area and you may find a very inexpensive plan or a plan that's even a zero premium. I would opt into it, even if you aren't taking drugs, and just, have that plan. And then in the future, during the open enrollment, if you need to change and get a more expensive plan, you can do it. And then you don't have to pay the late entrant fee.
Okay, thank you.
Thank you both. I think Sarah Barnett had a question and then Tony
Yes,
Russin.
I just want to say thank you very much to both of you.
I have a question.
I feel like we have to go back.
Anita, you'll need to wait a minute. We're going to ask Tony Russin next and then I'll get to you.
Okay, I have a quick
And
question.
the other thing is that, is it possible, Lynn, that you can send the, what is it called?
The slides, would you like a copy of the slides? I was thinking
And
we were
also
going to,
the introduction to Carol and Diane, which was not, so that we can thoroughly read them. Is that possible?
yeah, I mean, I'll be happy to share it with you if you'd like, as long as Carol and Diane don't mind. I did dig through LinkedIn, but it's fine.
Thank you very much.
I wasn't sharing any state secrets here. Okay, Tony, you had a question.
Well, first, I want to thank them for doing this. That was terrific and very clear. But as always, it comes a little too fast,
Yes.
so quickly. And this will be on the website, right? So I could listen to it again.
Yes, like all our
And watch
CCC programs, we have taped this. We have a YouTube channel. You can find it on our YouTube channel and get the link through our website.
Okay,
Or if you subscribe to Georgetown Village YouTube channel, you'll regularly get notification when we update it and add our CCC programs.
oh, that's good. All right, but now I have a question. One was,
Yes, whenever you need help, for sure.
okay. One of our members asked me if she was getting a scam in the mail when she received I think it was a pinkish postcard saying that she wasn't getting as much as she should out of her plan. She really probably would like to should sign up for it. I don't have the card in front of me.
Actually, Martha is showing the card. Wait a minute, Martha, I'm going to spotlight you so everybody can see the
You've got
card.
it. No, that's the wrong part of it. Not that
Okay,
part.
could you turn it over, Martha?
There.
So
Right,
this,
not-
Tony called me this morning about this, this
Thank
mailing.
you.
Mine isn't pink, but it's the same thing.
That's
Um,
it.
So what's happening is that because it's, oh, can you hear me all right?
Yes.
Okay, what's happening is because it's open season, essentially, lots of different companies and different brokers are sending out information to you, trying to see if they can get you to work with them to buy their product or to listen to their pitch about why you're not getting as much as you perhaps might otherwise. So that particular card that Tony, she actually sent me that this morning, and I called that number to ask, because it wasn't particularly clear that this is a Medicare authorized document or paper. And it turns out it was a company called eHealth Insurance. And eHealth Insurance is actually a company of brokers, and they basically help you understand what your choices are in your geographic area. So I did share with that company that they might want to make it look more of an official kind of, that they're authorized Medicare, et cetera, et cetera. But what you will get over the next, over these coming, days, weeks, you're probably going to get some calls, which can be terribly annoying, about people saying you might be able to get a better option. But yeah, that's yes, exactly. Those kinds of.
No,
Okay.
I have a separate. Go ahead.
The first words on the fine print on this are, this is a solicitation of insurance outside of the Medicare annual enrollment period. And this is the third solicitation I've gotten, one through AARP, one through my doctor's program.
Yes, I got one of those.
And this is the third one. So,
Right.
but is a solicitation.
Yeah. So
Well,
and
this-
some of them are very good. Some of them you just might want to, like the e-health insurance, the brokers from e-health insurance, they look at all of the options available to you and they will describe them to you if you wanted to do it. And yeah.
Okay.
Okay,
Thank you.
I'm not through with my questions though, if you don't mind.
Go for it, Tony.
Could I
All
add
right.
one more? Could I add one more point on that? I got a letter just today from AARP. I don't know that you can see it. It's a similar kind of letter. And I've had neighbors, they ask me, when am I going to stop receiving all these phone calls and seeing all these ads and getting all this mail? Well, this is as Diana said, this is the marketing period. This will likely
1
cease
month.
December 8th.
Yes. Okay, but my question, I got a little confused on the effect of your income on the payments. I've seen it hit I have regular Medicare plus the supplement, the gap. And whenever we sold a property, we get this huge increase in my Medicare payment, which is that also true in Medicare Advantage?
Carol,
They also,
Yeah, do you want me to answer that, Diana?
yeah, go ahead, Carol.
The income, as I understand it, the income-related premiums apply outside of your choice for Medicare Advantage. They're considered as additional funding for the program. And I actually read in a financial planning article in the Washington Post, and I'll have to plan for this. It's a 2-year look back period. I had to work through this for myself because I was working and then I got onto Medicare, and they looked back to my prior income and they were charging me the top amounts, and I was no longer making that kind of money.
exactly.
So maybe I shouldn't say that, but I was making pretty good money in the private sector. So I went, and you can apply, but it's a 2-year look back period, and they can tell you that you get that application, the ability to do that one time, but they look back each year, 2 years, to information they get from the IRS. And unfortunately, if the year in which you sell a house, that's considered income. 2 years later, the IRS is going to report that to Social Security, where they're looking at how much your income related premiums are. And both you and your spouse, or you, if you're by yourself, will pay the top amount.
Yeah,
So
it's painful.
And I don't know of any legislative effort to change that.
No, because you have to have a period to actually base the increase in tax on. And my understanding from working on some tax issues is that the 2-year period is about as close as you can get. It's very difficult, but we do owe the taxes, unfortunately, and you may not be in the best position to pay them in the 2 years later.
That's right.
Yeah.
All right, one more question. I'm having difficulty, for example, getting a new primary care physician. I don't know whether there's a big shortage in the Washington area of the ones that.
Tony, I have a great physician for you.
Oh, well, good. Because every time I get a reference, I find that either they're not taking new patients, or I finally got one that said yes. And she said, I'll see you in March.
Yeah.
Tony,
the thing about there are a lot of physicians who aren't taking new patients, but in addition to that, because of this COVID, I think it really has exacerbated the availability of different professionals in terms of getting booked in. Now, some physicians are completely free because nobody's going in for their checkups and things like that. For others, are really booked up, or they're really trying to stage it so there aren't a lot of people in the office at one time. So I think it's really exacerbated what was already not.
I figured, but
I'll call you, Tony, with a recommendation.
okay. Thank you very much.
Well, and Tony, here's the tip that very quickly there that I would say, just because I'm in the field, I knew that it might be an issue finding a new doctor because some won't take Medicare patients as new patients. So I made sure that I switched to a doctor who's younger in the practice that I'm in, and she's about 45. And hopefully she'll see me through the end of whatever time I have here. And there's usually no question if you're just move, if you're just moving on to Medicare and you already have a physician, they'll keep you. But it can be an issue finding a new physician if you're on Medicare and you're looking for a new doctor at that point.
Right.
Now, is it true that if you're part of Medicare Advantage, you aren't looking for a new primary care physician? They provide the primary care physician?
Medicare Advantage are required to make available physicians to you within very specific timelines. So yeah, you're not going to be waiting 3 months to see a primary care. In fact, there's incentives to have you, I'm trying to remember what they were now, but there's incentives to the Medicare Advantage plan to get everybody in within a certain number of days for their big checkup to see how they are coming into the plan and making sure they have what they need. And that, because from a Medicare Advantage standpoint, if you think about it, the government is paying the Medicare Advantage plan a fixed fee to take care of you. And what they want to do is to make sure that if you've got something that's not managed properly, that they manage it so that so that you don't become more of a problem down the road. So they have quite a big incentive to do primary care and get you in early in a Medicare Advantage plan.
Okay, that makes sense.
Kaiser Permanente, Tony.
Yes.
They check you from top to bottom to make
Yes.
sure they've gotten everything. And if they see something, they figure out what they're going to do about it. So they are free. They cover you like a glove. So,
yeah, and it is a 5-star plan, which is just quite remarkable how long they've been a 5-star plan. Because there's a lot of measures they have to win to get that rating.
And Diana, to your point just made there, I think those kind of measures roll into their star ratings, right?
That's right, absolutely right.
So you can look and see how well they actually do on those measures.
Right.
I think we had a question from Benita Lubick. Benita?
Yeah, Lynn, thank you very much. I have just one question. You're indicating that the drug plan for the Medicare is new, so that I now have a supplemental drug plan with AARP. So I can now drop my AARP drug plan and pick it up under Medicare?
So just so you know, and I'm going to let Carol answer the question, but when I said it was new, it was in 2006. So I was trying to give a time frame for the growth of the program. And to me, it was the new outpatient drug benefit is new, relatively new to Medicare, but it's still, well over, nearly 20 years old now. Carol, can you answer the Medigap question? I'm not as 100%. She shouldn't be dropping anything, right?
Well, AARP sells, thanks Diana, AARP sells both Medicare supplement plans and Medicare Part D plans.
Right.
So if you have a supplement plan at this point, the drug cover, what relates to drug coverage in it should be coinsurance reimbursements for Part B outpatient drugs. I don't think there would be Part D prescription drugs in there at this point, but we're happy to take a look and help you through that. It could be you have a Medicare supplement plan and a Part D plan that are separate, but both through AARP, but again, happy to talk to you about it.
But definitely don't drop anything till you
check on what you've got. Yep.
Thank you.
Thank you. I don't see any other questions.
I have one. Can I ask?
Carol, I'm sorry, Carol Robinson. There you go.
Yeah, the question is that they don't cover a routine physical exam. So if you want to have a routine physical exam, what happens?
Do you want me to take this one, Diana?
Sure.
I have a little personal experience with this, so I'm going to draw on that to help you. The first year that you enter the Medicare program, they have something called a Welcome to Medicare checkup, which is more extensive than once you're in the program after a year. And all they do at that point is assess your wellness with a Medicare wellness visit. They may not do blood work. They may not provide an EKG, the sorts of things that you're used to in a regular physical. What you have to do if you want those services is to talk to your physician and schedule an office visit And perhaps you've had some recent health issues that would require or suggest that the physician should do certain things for you, but it wouldn't be called a routine physical at that point. It would be medical services that you talk to your doctor that you need based on your health condition.
Okay, so an off,
So it's not a physical, it would be,
Yeah.
you would have to talk to your doctor about your health conditions and your concerns, and she would document or he would document for the program why they're doing certain things coming out of an office visit.
okay, thank you.
And just to add to that, Carol, just very briefly, what's really important to make sure that the doctor's office does not file that as a physical.
Physical.
That's exactly what happened to one case I worked on this year. This doctor filed it as a physical, and of course it was denied. And then we had to go back to the doctor and say, can you refile it as something else? And they did.
Well, that's
Good
helpful.
point.
Thank you.
Very good. And Fay Lang is sharing that you need to make sure that you check where you get your meds under D, because her level 3 drug is 1/3 less at Costco than CVS. And I think it always pays to shop around and double check prices, but thank you, Fay. Okay, are there any other questions? And if not, I would like to add my thanks to everyone else's. Diana and Carol, thank you both very much. I thank all of you who have joined us this evening. You might note I have a different background than I did when we started, so I'd like to invite you all to come to our December 3rd event. It will be a party. We are celebrating community. And as I mentioned last time, one of the silver linings to the COVID and this pandemic is that we can include our greater community. So this celebration is normally just for our members and volunteers. However, since we are online, we are happy to welcome you all as part of our greater community. You will be getting an email invitation. We do have your emails by virtue of the fact you're attending our programs. And we do hope you will join us. We're going to be having Jose Andres speak. We have some trivia games. We have members. We have lots of fun. It'll just be a nice evening, a chance to celebrate our 9th anniversary, and we invite you to join the celebration. I also want to mention that we have another Cocktails, COVID, and Conversations program coming up next week, November 19th. We usually don't have them 2 weeks in a row, but we know you're going to be busy for Thanksgiving. So we'd like to invite you for next week. It is on active grandparents in the modern era. And you're going to hear from 3 of our members who are active grandparents and how grandparenting is fitting in their life, both during COVID and before. So please join us. We do hope that you'll join us. We think you'll find it very interesting. And we look forward to seeing you. Again, thank you for joining us. And if you are a member of Georgetown Village, we do have these wonderful resources. Diana and Carol are happy to answer questions and in any way help you as you make your decisions coming into the new open season. As a federal employee spouse, I usually call it hunting season. But there you go. And thank you again. Have a pleasant evening, everyone. Bye
Thank
now.
you, Carol and Diana. That was great.
It really was.
Wonderful.
Well, good to see everybody. Good to see you, Diane.
Absolutely. Thank you both.